I'm Shawn Milburn. I'm an interventional pain physician at Commonwealth Pain and Spine. I'm from Lexington, Kentucky, and as my colleagues will remind you, I've lived in Lexington my entire life. I did UK for undergrad and medical school and residency and fellowship, and so I've lived in Lexington my whole life. I was originally drawn to interventional pain from anesthesia. I would sedate patients in the operating room and perform nerve blocks and things, and then I discovered that there was a way for me to have a longer longitudinal relationship with folks instead of seeing them multiple per day and not really having a follow-up appointment or seeing how they did. And so I was kind of drawn to interventional pain by that. I did a rotation when I was in residency and then of course did a fellowship and found that there was a way for me to have a more prolonged duration of care of people and connect with my patients in a little more meaningful way. I have all sorts of people. I've got young people who have lifted weights and have an acute injury of the back that, we try to fix that if you're young and this is an acute issue. And then I have older patients who have chronic issues that have been around for a long time. My overall goal for every patient I have is to improve their life somehow in a meaningful way that's sustainable and what's best for them overall. So when we meet for the first time, you can expect to originally come in the office and meet our front desk staff and a medical assistant who will work you up and get your vital signs and talk to you about your medical history. When I come in the room, I've already read a little about you and I know your backstory of, generally speaking, what's going on and how long it's been occurring, and I've usually reviewed your imaging. I'll sit down, I'll kind of ask you about what bothers you the most in terms of pain in your body and get some more details about that. If you have any pertinent imaging like an MRI or an X-ray, I'll usually pull it up on the computer and we'll look at the images together to talk about what I see, and so I can really involve you in your plan of care. Depending on what sort of issue we have going on, I'll then explain to you with usually a spine model of some kind. Visually, I'm a visual person, most of my patients appreciate that as well. What we're thinking is going on and how we can address it. And so I kind of try to go in a stepwise fashion like that. So my fun fact, I'll give you two. Number one is I'm a rabid UK football fan. Basketball I watch and I enjoy and I cheer on. I go to most of the away football games, and like Dr. Young and some of our Georgia Bulldog fans like to remind me, we haven't beaten Georgia in I think 12 years now. This is going to be the year, I think. I also have a saltwater fish tank in my basement, and I'm a pretty avid reefer for growing coral and fish in my house, and it's over 500 gallons. It's maybe more than a hobby at this point.